Hi, with recent announcements, it appears that Australia has lost the initial attempt to tightly contain the spread of the coronavirus, COVID-19, including reports that it is now starting to spread within the health workforce itself. There is now a need to consider how we can develop plans to ensure that we actually have enough doctors, nurses, allied health and other important staff to cope with a predicted environment where there are increased cases of viral illnesses presenting to our health services and large amounts of staff either sick or in isolation. Now, it has been suggested that we will need to pull staff from some of the existing pools that we tend to rely upon to deal with shortages in health workforce, such as locum or casual staff pools. But these sources are often already closely tapped. It's also been suggested that we may need to bring doctors and other health professionals back from leave or out of retirement, which may help to an extent, but a big group of doctors has not been thought about so far. What doesn't seem to have been considered so far is that there is another large group of doctors already in this country who are champing at the bit to get involved in helping with this potential increased demand on our health system. There are literally hundreds of IMGs, international medical graduates, who could fill basic posts in hospitals. According to the latest sources from the Australian Medical Council, there were 660 international medical graduates who were vetted to commence supervised training posts as part of what's called the standard pathway process in 2019. And they did this by obtaining what is called the AMC certificate, which is normally a two-step examination process. Now, it's difficult to know exactly how many of these doctors have then been able to obtain positions, as they need to work supervised for a while. And it's hard to get a link between those who obtain this certificate and registration status. But according to the federal government's workforce data set, I could find data on the number of doctors who had completed the AMC process and been granted what's called provisional registration for 2018. And the number of completions of the certificate that year was 862, and the number provisionally registered that year was 76. Now, some of these doctors may have already obtained what's called limited registration, for which there's no accessible data. But I think it's reasonably safe to assume, given that the number will accumulate every year, that we're talking hundreds, if not over 1,000 or more, IMG doctors with an AMC certificate who have been vetted, who've not been able to obtain a position so far in Australia. The number of IMGs who contact me in these circumstances backs up this contention. There are also quite a few specialist IMGs who could help out as well. Probably not as many, but whilst the data from the Medical Board of Australia is a little bit older, we know that in 2018, 755 specialist IMG doctors were approved by our medical colleges to commence supervised postings to work towards what's called specialist recognition. Whilst in the same year, only 614 specialist IMG doctors were recommended or not recommended for specialist recognition. Now, whilst we're talking separate groups here, i.e. those at the start of the process and those at the end, again, anecdotally, I'm aware of many IMG specialists who've been granted approval to work as a specialist under supervision, who have been waiting now for over a year, and in some cases 2 or many more years to get a position. So whilst the number of specialist IMGs who have been approved and are still waiting is likely to be far less than those on the standard pathway, it is still likely to be in the hundreds of doctors. So why are these doctors not employed already? That's a good question. The problem for most of these doctors is not their lack of competency or capability. This is, as I said, has already been assessed. It's just that there are limited places for them and strong and stiff competition for these places. When these doctors do get a chance of a job, they generally do very well, and they are often willing to work in places and in circumstances that locally trained doctors do not want to. Many of these doctors would just jump at the chance to work for, say, 3 months to help out with the current emerging health system crisis. So what would need to change to make this happen? Well, one of the big problems with getting IMGs up and running in positions in Australia has always been the bureaucracy involved. This bureaucracy includes paperwork to establish that the doctors are not competing for a post with an Australian trained doctor, paperwork to satisfy the registration requirements, and paperwork to obtain a working visa. It is important that we maintain a certain standard of care in the registration requirements of doctors, But given that we are anticipating that there will be many vacancies at various levels in the system, it is reasonable to assume that many of these vacancies will be in posts that are supervised and supervisable, for which an IMG doctor could be deployed. Conversely, a system whereby such an IMG doctor could be more quickly granted a short period of registration, let's say about 3 months, would provide ease for the system, but also reduce the risk of such a doctor not being supervised properly across the longer term. It also then give the IMG actual experience in the Australian healthcare system, which is something that would tremendously help their resume and their case for future employment opportunities.